When people come to us for dentistry, it's not all about dentistry, because when I look in their mouth, I see other things. And one of the things I see signs of obstructive sleep apnea. And what I say to them, and it surprises most people, because most people don't want to admit that they snore or have a problem with that. So they think, oh, I just have headaches in the morning and that's normal. It's not normal. It's not normal to be waking up multiple times during the night. But what I say to them is I'll be looking at them and I'll be talking about their teeth and I'll say, when was the last time somebody told you that you snored? And they're like, how do you know that? And I explain to them, well, I can see these breaks in your teeth that when your tongue falls in the back of your throat, cuts off your airway, your brain's not getting oxygen then. Your brain says to my heart, speed up, raise the blood pressure, get that tongue out of my throat. When that happens, it's a fight or flight response in your body. You don't realize it because you think you're sleeping, but when your teeth clench together during that fight or flight response, your tooth flexes and it breaks out the enamel along the edges of your gums. So if I see something that looks like a little V right along your gums, that's a hint that you grind your teeth severely or you have obstructive sleep apnea. And there are other signs. If the teeth are flat on the top, if I look on the x-ray and I don't see points on the teeth, I see flat, they're grinding severely. And so when I see those two things, or I'll see a big tongue that has, it looks like scallops along the side, like waves, that's because that tongue's getting pressed super hard between the teeth, the spaces between the teeth, and that means there's not enough room for that tongue. And it's the body's way of trying to get the tongue out of the way so you can breathe. So when I see different signs and symptoms that they'll tell me about, I know that they're having a problem with that obstructive sleep apnea. So I offer to help them in a way that's not embarrassing in any way, it's helpful. And we offer to do a free screening that they can take home in their house, not in a hospital, to find out if they truly have a problem with that or they don't. And obstructive sleep apnea is one of the biggest, almost epidemics in this country today, and people are at risk for heart attacks and strokes. What I love the most about my job is when a wife comes in and says, my husband snores and keeps me up all night long, and then her husband comes in, I solve the snoring, and guess what? Now they get to sleep in the same room together and they're smiling. If that's not appreciation, that's what we thrive on. We thrive on people being happy with what we do for them. And when we can get two people to sleep together again and be happy with each other, as opposed to elbowing each other and complaining, that helps their family life in ways that fixing a tooth will never do.